Welcome back. Earnings alert. Premier Inc., a healthcare solutions company delivering better than expected second quarter earnings after the close yesterday. Susan DeVore is the CEO and president of Premier. She joins us right now. Susan, good to see you. Thanks so much for joining us.
Thank you.
So tell us, characterize the business right now. Obviously, we talk a lot about the cost of drugs. Actually, we had Martin Shkreli on a week ago, and he made the case, as bad as people think he is, that you need competition in the industry. What drove the quarter?
So the quarter for us was driven by very good performance in both segments of our business, the supply chain side of our business and the performance improvement side of our business. So we're seeing great growth in all of our revenue drivers.
So how would you characterize things right now?
Things right now for us, because we are focused on improving healthcare, improving the cost and quality and safety of healthcare. For us, all this challenge in drug costs and in the performance of healthcare systems gives us opportunities to help them improve.
Well, we've got a picture up of the stock price. As you talk, you reported good earnings numbers, but the stock price is way down. What's going on there?
You know, we are focused on the long term, and we are a domestic company focused on improving healthcare in this country. We don't have China risk. We don't have currency risk. We think the market is moving in ways that we can't actually control, so we stay focused on improving healthcare from the inside.
Does that have anything to do with the looming presidential election? Because a new president, good or bad, is going to have a terrific or maybe horrible impact on healthcare in this country, and there's a lot of unknown.
You know, healthcare is one of the biggest social and economic challenges we have as a country, and regardless of who the president is, the focus on cost and quality improvement and safety improvement, really changing healthcare from the inside, is going to exist. And so from our perspective, using our data and using the capabilities we have as a company to help healthcare systems fix this from the inside. Physicians and patients and hospitals working together to make it better.
So how do you do it? I mean, how do you fix from the inside? You've got healthcare growing twice the rate of the overall economy, the cost of drugs going up, even in the face of generics trying to take those prices lower.
Right.
Do you want, I mean, if we were to see caps in drug prices, is that an answer?
You know, we don't think price controls work. We don't think price controls work at all. We think competition works. And what we do on one side of our business is really aggregate the purchasing of these healthcare systems so they buy drugs and devices together and lower the cost. Drug costs, you know, grew 12% last year. Drug costs for companies that are competing on contract through Premier grew at 1.8%. So we think competition works, but you've got to have enough suppliers in the space.
One of the health systems, Universal, said that they may not participate in Obamacare. I mean, the Affordable Care Act. Do you want to see it changed?
You know, I think Obamacare created a framework for reducing costs and improving quality and providing access to care, and I think it will continue to be debated. But the challenges of cost increases and the challenges of quality and safety continue to exist. And so whoever is the president or whatever happens, we have to work to fix that from the inside.
Are you hiring right now?
We are hiring. We are hiring. We're growing double digits.
Does this market volatility give you any second thoughts about how aggressively you want to proceed?
It doesn't for us, because we stay focused every day on how are we going to help healthcare systems transform from the inside. And they have a lot of challenges, and that fuels our growth.
Susan, good to see you. Thanks so much.
Thank you.
Susan DeVore joining us. Next